If your care team is working 10-hour days but you still cannot prove the value-based care outcomes to payers, or if you're constantly worried that an unexpected compliance audit would reveal gaps in your discharge documentation, then you are operating in the dark. By the end of this video, you'll know exactly how to design and execute a healthcare program evaluation framework using precise, standardized case management key performance indicators. We will cover how to measure clinical workflow efficiency metrics, how to balance staff workloads using active analytics, and how to configure your systems to prove your exact return on investment under modern reimbursement models. The core problem with retrospective measurement. Most care-based practices evaluate their success retrospectively. They wait until the end of the quarter or the end of the year to pull claims data or hospital readmission reports. This is a lagging approach. When you rely solely on retrospective reporting, you cannot intervene when the program is failing, when a clinician is burning out, or when a patient's health is actively declining. Real-world evaluation must be formative and process-driven, active in real time. If a major payer asked you right now to show the exact rate of medication adherence for your transitional care program over the last 30 days, how long would it take your team to generate that report? Consider a mid-sized clinic managing 400 chronic disease patients. Without an active evaluation framework, they notice a sudden spike in 30-day readmissions. By the time they pull the paper records to conduct a manual audit, 90 days have passed. They discovered that a critical care transition protocol was missed over half of those patients because a single coordinator was overloaded. The financial penalty for a payer is already locked in. To prevent this, you must establish a healthcare program evaluation framework that captures data at point of care. This means integrating your care coordination software solutions directly with your daily documentation. Every clinical assessment form, intake packet, and discharge checklist must write back to a centralized dashboard immediately. You cannot measure everything, and attempting to do so leads to documentation fatigue. You must isolate specific case management key performance indicators across three primary categories: clinical quality, operational efficiency, and financial health. Clinical quality metrics focus on patient recovery and compliance. Operational metrics target speed and staff capacity, while financial metrics track utilization and reimbursement success. According to a study published in the American Journal of Managed Care, organizations using structured clinical evaluation experienced a 32% improvement in chronic disease self-management metrics over 12 months. Let us look at how you balance these metrics in practice. An effective operational dashboard should display time to initial assessment, measuring the speed of your intake, care plan adherence rate, tracking the patient compliance, staff caseload distribution, ensuring no single clinician is over-allocated, and the average length of stay, monitoring the resource utilization. Set clear thresholds for each metric. For example, you target for time to initial assessment should be under 2 hours for patient admission. If your digital system flags that a patient has been waiting for 3 hours without an assessment, the system should automatically escalate an alert to the supervisor's dashboard. Clinician burnout is directly tied to the healthcare administrative burden reduction goals. When your staff spends hours copying demographic details from paper intake forms into an electronic medical record, they are not delivering care. Optimizing clinical workflow efficiency metrics require analyzing the exact time case managers spend on non-clinical administrative tasks and replacing manual handoffs with automated care transitions. Imagine your highest performing nurse case manager spending 2 hours of their shift formatting a Microsoft Word document to send a discharge packet to home health agency. That is not just inefficient, it is a massive clinical liability. Standardized clinical assessment tools should be digital and self-populating. When a patient completes a screening portal at home, those responses must map directly to their clinical profile, instantly calculating risk scores and flagging critical concerns. Map out your clinical pathways, identify every step where a clinical coordinator must manually copy data, send an email, or make a phone call. Use care team collaboration platforms to automate these workflows, triggering downstream tasks. Modern healthcare evaluation is incomplete without health equity tracking. Federal agencies like the Center for Medicare and Medicaid Services and the National Committee for Quality Assurance now mandate the collection of demographic details, including race, ethnicity, and gender, to identify disparities in care delivery. This data is a core pillar of social determinants of health tracking. Non-clinical factors such as transportation barriers and housing instability account for up to 80% of health outcomes. Suppose your dashboard reveals that your overall transitional care program has an 82% success rate. However, when you filter those outcomes by demographic factors, you discover that patients living in a specific zip code have a 45% higher readmission rate. This isolated insight tells you where to deploy targeted community resources. Your software platform must support demographic equity insights natively. Ensure your client intake process includes structured, non-stigmatizing fields for social needs and build matching reports that allow you to filter outcome metrics by these key demographic parameters. One size does not fit all in case management. A program managing geriatric dementia patients has entirely different tracking needs than a program focused on pediatric asthma. To build a truly effective evaluation model, you need the ability to add custom fields to client profiles and run custom reports instantly without needing a dedicated IT department or software programmers. If your software requires you to submit a support ticket and wait 3 weeks just to add a new tracking dropdown to your intake screen, your software is actively blocking your clinical growth. Let's say you launch an innovative post-stroke rehabilitation program. To measure your success, you must track when patients achieve unassisted mobility. Since this is a niche metric, your software does not have it by default. With an adaptable system, you can create a custom drop-down field labeled stroke recovery milestones directly on the client profile. Step 2, you build a custom report that filters all active clients in the post-stroke program by their assigned coordinator and their mobility level. You now have a custom real-time outcomes dashboard built in under 5 minutes. All right, now let's recap. Implementing evaluation in care-based practices is not about adding administrative work. It is about refining your process to protect your patients, your staff, and your revenue. To do this successfully, first, transition from retrospective reviews to real-time point-of-care data capture. Second, select a balanced mix of leading and lagging case management key performance indicators. Third, actively analyze and mitigate clinical workflow efficiency metrics to prevent clinical burnout. And finally, embrace adaptability by choosing systems that let you customize fields, track demographics, and run custom reports on demand. To see how a fully customizable platform can automate your healthcare program evaluation framework, click the link in the description below to start your free trial of Case Management Hub. Setup takes less than 2 minutes and no credit card is required. Start measuring your clinical success and proving your true financial ROI today. Once you click the link, you'll be brought to this page. Just enter your first name, last name, and email, as well as your organization name, and select your practice area. We also recommend that you enter a phone number. To see analytics that track clients per program, live staff caseload, demographic equity, and aggregated form reports, step 1, navigate to the Reports and Analytics module from the sidebar. Step 2, select whether you want to view reports on organization, which would include reports on clients per program, staff caseload, etc. Demographics, reports on race, ethnicity, gender, and so forth. Forms or goals. Here's a tip. All of the reports can be filtered by date as well as other data such as program, client, staff, and much more. Step 3. Dig deeper into report details by clicking the magnifying glass. Then, from the detailed pop-up, you can export both the graph and the data table. Here's another tip. The graph report can be viewed in either a bar or a pie chart for a better visual look. Step 4, you can export your entire dashboard or selected reports by clicking the cloud icon and then selecting the individual reports you wish to export. Step 5, create a custom report by clicking the plus icon and selecting from either client, staff, or program fields. Generate instantly a truly personalized report. Once done, click Create. Here's another quick tip. If you've already created custom fields on the client profile, you can easily select them here to create a custom report. And don't forget to like this video as it lets me know that you've received value from it. You can also subscribe to the channel so you don't miss great content like this one.